We're going to have a visit here with Dr. Amy Tarnower. Dr. Tarnower is the Associate Medical Director at the UNM Cancer Center, and she's all about the whole pink thing going on, and she is a breast cancer medical expert as well. And welcome, Dr. Tarnower, to the show.
Thank you for having me today. It's really a pleasure to be here.
We got our pink going just for you and the whole cause here.
Absolutely, and if you come out on Saturday night to Lobos Think Pink, the Lobos love pink this year, and the Lobos love pink is all about the patients and families who are undergoing treatments and are survivors, and really an evening of celebration of life and being involved with the community and being out there and living the life you want to lead. Just being there. It's great.
Yeah, so tell us a little bit more about, so Saturday night at the Lobo football game will be Lobos Love Pink. So tell us all about what that's about.
So the Lobos Love Pink starts out with a tailgate party of its own, and then the patients and families get to come to the field. They get introduced at halftime. You see the players wearing their acknowledgement of pink with wristbands, sometimes socks. You see some of the band being dressed up in their pink t-shirts. And it's really a celebration and an acknowledgement of living life and being a survivor.
And the fans can participate too. They can wear pink to the game.
Absolutely. And they're pink pom-poms, and often these foam pieces are given out. And it's just an evening that's really fun of acknowledging how common a disease this is. 1 in 8 women will perhaps be diagnosed with breast cancer in their lifetime. And here in New Mexico, we have a National Cancer Institute, an NCI designated cancer center. We're the only one in the state. We're one of 68 in the country, and we really have a big team to be able to help take care of patients and be there for them.
Yeah, obviously this is a very serious disease, but I love what you said at the beginning, that this is a celebration of life. It's a celebration of the fact that treatment is there for people who get breast cancer, and there's a good chance of surviving it.
Absolutely.
A better chance than it used to be.
If you get diagnosed early, which is all about screening and getting your mammograms done, you have a very high chance. 90% chance of being a long-term survivor, and that there's a lot of hope, even though the diagnosis is very scary.
Yeah, especially with UNM Cancer Center right around the corner, and that they're a big help. And can you tell us a little bit about what UNM Cancer Center is doing, not only for people with breast cancer, but just for the month of October?
Well, for the month of October, this is our big event, and so this is our big focus, and I love that UNM can partner with the athletic department and you bridge those gaps within the university. But what we do is we have about 86 boarded oncologists taking care of cancer patients. We have 126 researchers. So it is a constant meeting of how do we blend the current research and take it to our patients and make it real and make it happen. So we call that translational research, but that's what we spend a lot of time doing, of trying to understand what's being done in the labs, what's being done with epidemiology. How can we take this to New Mexico and make everyone have better care and better chance of survival and a lot of hope?
Now, this whole message of early detection, has it gotten out? Are you seeing a lot of women coming in who have spotted this early? And,
oh, absolutely.
I mean, the message is resonating, isn't it?
Correct. And so the majority of women nowadays are diagnosed with very early stage breast cancer.
Right.
And it's highly treatable and highly curable.
The key is early detection.
Correct. And so really encouraging folks to get their annual mammograms between ages 40 and 70. And if you're older than 70, to go ahead, if your general health is good, you still need mammograms. And the reality, the two biggest risk factors for breast cancer is being female and your age. And so you don't want to just, if you're a healthy 75-year-old, you still need to get screened. You still want to make sure that you're one of that early stage folks.
It's not just for young women.
No, it's a disease that can happen almost any time, but it's the detection with mammograms actually highest with women who are postmenopausal.
Wow.
You're looking at the change in the breast tissue, and you're able to see it better with them. So there are new things coming up for screening younger women. Is there a better tool? And those are some of the things that we're exploring right here in New Mexico.
So are a lot of the I mean, we've heard so many doctors come on our show and talk about just all the research that's being done with cancer. Is there any new progress with breast cancer?
I'd say that the area of breast cancer that's making real strides is a subtype of breast cancer that has a certain protein on the outside of it called HER2. And we now have 4 or 5 new medicines in the last year or two that are specialized to treat that subtype. So yes, we're finding out more about the biology of the disease, and when you know what the biology is, then you can develop treatments that are going to be very specific and benefit specific situations. So that's where we're really headed, with molecular biology being understood and then translating that into treatments for folks.
Theories on causes?
Oh boy.
Yeah, I mean, that we do a whole
that's
show
hard.
on that.
Yeah, and it's really hard because the things that we know that you can do to reduce your risk of breast cancer is maintaining a healthy weight. Regular exercise seems to help your immune system and help your body be able to fight off cancer. A lower fat diet. Not very American, but those are the things that we know help. Not taking estrogen supplements after when you go into menopause. Having prolonged estrogen exposure is not good for the body. So those are the things that you can do as preventive measures.
Now, just here in UNM or in UNM in Albuquerque, have you seen numbers go up or down with cancer patients, breast cancer patients?
The breast cancer patient in the state is staying about the same. So it's and I think we're doing a good job of finding things early.
Yeah.
And so that's really the key. I don't think we're seeing an increase, and we're actually finally seeing a decline in dying from breast cancer. We're making strides slowly, being able to have patients live a normal life and not be affected by this.
Yeah. And one of the biggest things that I hear is usually the first time you get diagnosed and it's all great and you think you don't have it, and usually it comes back.
About 10 to 15% of women will have breast cancer come back.
Yeah.
And there are subtypes there as well that do well. So women who have breast cancer that come back in the bone often live more than a decade.
Okay.
And so there are different subtypes. Yeah. And that's one of our real challenges is being able to look at the subtype at the time of diagnosis and getting the very best care then to reduce your chance of the breast cancer coming back. Absolutely, that's
great.
But it is scary because breast cancer is a funny disease because it can come back a year later, but it can come back 15 years later, and that's the stories that you hear.
Yeah, and that's one of the scary things that I hear about. So I'm always worried.
Yeah, we offer a survivorship clinic for women who are after 5 years.
That's great.
So they still get seen on an annual basis. They get their history reviewed. They get a physical examination. We go over things that are very specific for breast cancer and whether there are risks, and continuing educating folks about how they can reduce the risk.
That's what I like about what you're doing and the rest of your physicians and staff there, because to get it out of the exam room and get it out into the public and tell people and have these awareness campaigns and let people know that there's help and treatment and hope for people.
Right. It doesn't have to be a scary experience.
Right.
It can be a positive experience that helps you realize ultimately how precious life is and to go out and live the life you want to lead.
And you help people all throughout New Mexico. It's not just Albuquerque.
No, New Mexico Cancer Center is really proud to have branches down in Las Cruces. We serve folks up in the Santa Fe area and have bridges with some of the docks in Farmington and other areas in the state. So yes, we are happy to serve the state, not just Albuquerque.
Great.
So it's the Lobo game this Saturday.
This Saturday.
Against Utah State. Wear your pink. and the players are going to be, this is you and your family, right,
This is last year.
Dr. Tarnower?
I'm kind of in the middle with the white hair. My daughter's in front of me, my husband behind me. As you see, we're out on the field, and the guys came out and started practicing. This was at halftime. It was really amazing to see these, how big they are and how fast those balls are going. And
Fun experience.
it was very positive for everyone. We had a ball.
So wear your pink to the game.
Yeah.